Howdy! In this video, I'll be answering viewers' questions about multiple sclerosis. Don't turn away, because that starts right now. Clement from Australia asks a really intense question. Why has my MRI not changed in years, i.e. no new lesions, and yet I continue to lose function or deteriorate? And this has to do with what I call the devil's price, where you can pay twice for a lesion. When you have a new area of brain damage, a new lesion on the MRI, it can have a correlate to an MS attack or a loss of function. And your brain tries to repair, and it also tries to rewire around the area of damage. And so functionally, you can regain some or all of your function, but there's still damage. So when you look at the MRI, you can still see the area of brain damage. As you as a human being age, and as your brain ages, those areas can wear out, typically around 10 to 15 years later. And you can have progression of neurological disability. In fact, what you see is a return of those old symptoms, recapitulating the old injury, not because of new inflammation, but because the old area is wearing out. I sometimes use an analogy to explain this to a family. I'll say, if I blew a hole in the wall with a shotgun and didn't repair it, and then 15, 20 years later, the building had aged, and the materials in the building aged, which wall falls first? The one with the hole in the wall. This is a situation where someone can progress in neurological disability and they haven't had an attack and they haven't had new spots. I actually did a video on this recently, so I'll throw a link right there in case you want to check it out. It's called, Why Am I Worse? Our next question comes from Gaia, and if I said your name wrong, I apologize. It's a really good question. What do we ask the neurologist after an MRI and a follow-up appointment? First off, I think that you should always have a prompt follow-up appointment after an MRI because I think it's something that you want to review with the neurologist. Secondly, I think it's important that the neurologist look at the actual images, not just read the report. Thirdly, I think during that follow-up visit, the neurologist should show you the images and go through them with you. Fourthly, I think they should actually show you your new MRI that you just did and last year's MRI side by side so that together you can look through it. And I think that's something that should happen with every MRI. It's one of the main ways that we assess if your disease-modifying therapy is working, if there's new structural brain or spinal cord damage. It's really important. And I think that you, as the person with the brain that we're talking about, should be super included in all of those things. Now, what do you actually want to know? I want to know, as compared to the last MRI, are there any new T2 bright spots, so the white spots? Or are any of the bright spots bigger? Did they grow compared to last year? Second, I want to know if we gave contrast, do any of the lesions light up with contrast enhancement? Third, I'd like to know if there's any new or enlarged black holes. Fourth, I want to know if I see increased evidence of brain volume loss or accelerated brain atrophy. Those are the things that I think you should look for and talk to the neurologist about. Most excellent question. Thank you. If you like this content, do me a kind favor and give me a thumbs up. And if you haven't subscribed to the channel yet, please consider doing so. Those two actions teach the YouTube algorithm that you like this content and help push it out so more people can see it. Thank you. Beck Lacey writes, I'm 56 years old and have been diagnosed a year and a half ago with primary progressive MS. Are there a lot of mental health involved, like depression or anxiety with this diagnosis? Well, Beck, that's an excellent question. And the answer is yes, absolutely, and very much so. People impacted by MS are twice as likely to experience depression or anxiety compared to the general population. And I think it's important to hear that it's extremely treatable. There's a lot of things that can be done behaviorally, with counseling, with medicines, to optimize someone's mood, treating both depression and anxiety. Here's a link to a playlist on mood in multiple sclerosis, and I hope that you find some of those videos helpful. Alex writes, Dr. B, you're looking thin. Is that intermittent fasting working for you? Well, Alex, thank you so much. And yes, I am loving intermittent fasting. I'll throw a link to a video I did about intermittent fasting right there in case people want to check it out. And again, thank you for the very kind words. Mark asks, what are the benefits, risks of a baclofen pump if you're still able to walk? So I love this question because I really love baclofen pumps. I actually have several videos on this channel where I talk about baclofen pumps, so I'll throw a link right there in case you want to hear about them. To quickly answer the question, a baclofen pump is a way of directly delivering baclofen to exactly where it needs to go, which is the back of the spinal cord. It bypasses all the rest of the body, and it bypasses all the side effects associated with baclofen when it goes everywhere else. So really, there's no baclofen measurable in your bloodstream because only very small amounts are being dripped into the spinal sac. And so you can have a very robust effect to spasticity, decreasing stiffness, spasms, cramps, etc. And oftentimes we get people completely off their oral medicines. The benefit portion of the discussion is getting people off oral agents and better controlling spasticity with less side effects. The risk portion is that it's a surgery to have it implanted, and that if it breaks or gets infected, that's a surgery to repair or fix that. If you'd like to hear more answers to MS questions like these, click the video that's on your screen right now. Until my next video or live stream, this is Boster saying thank you for learning about MS with me. Be safe and take care.